Congratulations on having your expander fitted. Here are some instructions on how to look after your braces and how to activate your expander. Right after you get your expander fitted, it may feel tight and somewhat uncomfortable. Occasionally there is some tenderness and soreness of the teeth for a few days. Don't worry, this will pass and soon it will feel a lot better. Sometimes discomfort may also be encountered while the expander is being turned, usually as a very tight or pushing sensation. This is again normal and it will subside approximately 10 to 30 minutes after each activation. Also, in the beginning, your speech may be affected slightly, or you may feel you cannot swallow effectively, or that some food or saliva remain close to the palate after swallowing. This is normal and will improve in a matter of days as the tongue posture adapts to the presence of the expander. In the meantime, practice swallowing, often small sips of water and food into small pieces to keep chewing to a minimum. Eating soft and easy food also helps during the first few days. If you experience soreness around the cheek area, please use dental wax to help ease any irritation. The bands of the expander are fixed with special adhesive and should stay on for the entire duration of the treatment. Generally, it's very important to eliminate sticky food like sweets and gums or hard crunchy food, as these can damage the expander. If you feel that the bonds are loose, please call us immediately so that we can check and if needed cement the expander again. It's also important that you maintain excellent oral hygiene, as food and plaque can get caught between the brace and palate or the teeth. Make sure you brush thoroughly 3 times a day, especially around the bands. If that's not always possible, at least rinse with mouthwash after eating and brush and floss your teeth as soon as you can. Please do not try to fit the toothbrush between the expander and the palate. By about the 2nd week of activation, you will develop small space between the 2 front teeth. This is normal and indicates the expander is working well, as the suture on the palate is now effectively stretched. Make sure you lie down either on the bed or the sofa, and you can use flashlight for better visibility. You would need to activate the expander by turning key as instructed by your orthodontist. The key used for the activation is designed with safety bend, so don't worry about it reaching too far or touching the palate while you're using it. At first, find a hole towards the front of the mouth and gently insert the key into the hole until you feel it stopping at the safety bend. Then nudge the key from the side to side to check it's in the hole securely and bring the handle close to the front teeth. That's how you know you're in the correct position. When you're ready to turn, push the key towards the back of the mouth, holding it upright. You need to push all the way until you see the next hole appearing, and the key cannot go any further. That would be 1 complete turn. Pause for a moment and then gently remove the key. Make sure to gently move it straight down without pulling it again forward, as this would reverse part of the turn and could hide the next hole.
To make sure.
If you want to double check,
Put
place
it in
the
the
key
hole again.
into the
Nudge,
new front
nudge.
hole again.
Cool.
If the key goes in, okay, you are
Here at the
all
London
done.
Orthodontic Group, you can purchase an orthodontic starter kit to help you with your oral hygiene. The kit includes a travel toothbrush, a double-ended toothbrush, mirror, floss threader, floss, disclosing tablets, wax, a timer, an interdental toothbrush and mouthwash.